Ankylosing spondylitis. It is a complicated disease, and it's complicating for one area veteran who says his spine is fused into one piece. Thanks for joining us tonight.
He can't use his legs, can barely use his arms, and is in excruciating pain. But he says the VA cut him off from his high-powered drugs because of recent changes in policy, one that says your doctor can drug test urine, saliva, and blood to make sure you're not abusing.
Now, they say it's an attempt to combat what the CDC reports as a 415% rise in prescription pain overdoses. Valley News Team's Bradford Eric talks with this vet about what he calls an attack on his constitutional protection.
I come off that stage and it was like, oh my God.
That's Michael Needham on stage at this year's Sturgis Motorcycle Rally. He's in a wheelchair because of his disease, ankylosing spondylitis. And according to the Mayo Clinic, there's no known cause.
My neck don't turn, okay? That's about all I can get out of my arms. My spine is all one piece. My ribs are fused here. It's all one solid piece. I'm breathing in a barrel.
Needham says that's why he sought relief. He served briefly in the Navy during the Vietnam era, but was discharged because of his medical condition. Over a decade ago, he was living on the West Coast and went to see a doctor because the pain had gotten so bad. He was handed a prescription. His family then moved to Gackle, North Dakota, and he saw a new doctor at the Fargo VA. The treatment was working, so he kept on using painkillers.
Hydrocodone in the morning when I got up, because it's fast acting. I'd give it a couple hours. Take my morphine.
And then later in the day, a booster hydrocodone. Needham says it was working fine. It was to a point where he could still function and it controlled his pain.
And then in December, we get this new policy.
He's referring to this, VHA Directive 1005. It's titled Informed Consent for Long-Term Opioid Therapy for Pain. The document says that pain management, quote, requires special attention to personal and public health risks, which include, quote, risks to the public through diversion of prescribed medications. It means anyone seeking pain medications like Vicodin, Percocet, OxyContin, and morphine has to sign this, a consent for long-term opioid therapy for pain. It contains a description of the treatment, and halfway through reads, quote, your provider will monitor your prescription. This may include testing your urine, saliva, and blood. Furthermore, on the last page of the agreement, it states, I understand that my provider may order urine or blood drug tests, and that your refusal could mean the end of treatment.
And that's what the urine drug screen is for, is to allow the provider to know when the situation is riskier and to take that into account when working with the medications.
Dr. Breton Weintraub, Chief of Staff at the Fargo VA Hospital, says the drug tests are not to monitor addiction. They're for safety. He says doctors need to know what's in a patient's system when prescribing powerful painkillers. I asked Dr. Weintraub, how is this not a violation of the Constitution? How is this not an unreasonable search and seizure?
So it's not a VA thing. It's what pain specialists believe is the right treatment for people. And again, the decision is whether this is the right treatment for the person.
Dr. Weintraub says if a vet wants relief through long-term painkillers, these are the rules. But he even admits it's not entirely the VA's idea behind the agreements. Part of VHA Directive 1005 lists the offices responsible for creating these types of agreements: the National Pain Management Program, Office of Patient Care Services, and the National Center for Ethics in Healthcare.
There can be false positives and false negatives with it. Depends a little bit on which substance you're testing for and what's the relation to when the person ingested it versus when you check.
In the last 5 years, one study analyzing urine samples found a third did not detect the drugs prescribed by a doctor, and another study at a VA facility found over a quarter of patients tested negative for what they were prescribed.
So no, unfortunately, this is the best tool that we have. And one of the key things is to make sure that providers are educated so that they understand the limitations and the abilities of the testing so that they can interpret it properly when they have the results.
But Michael Needham still feels otherwise.
There has to be a way, constitutional way, especially with veterans. We have honor. Ask us, can you pee clean? Well, if not, why? What are you taking? If it's nothing serious.
I asked him how he would rate his pain during the interview. Needham replied a 7 out of 10. He quit his powerful pain meds cold turkey last year, and it nearly killed him.
But the assumption of guilt is there. It's the,
Assumption of guilt?
if you won't pee, you must be dirty. Okay? My whole family is going, why don't you just go pee? It's because I'm not going to be forced to.
In the meantime, Needham says he's written to Senators Hoeven and Heitkamp and Representative Kramer, pleading with them to overturn this policy. Needham said he's coping for now, but the pain is still unbearable. Bradford Eric, Valley News Live.
If you need help uncovering fraud or corruption in your community, call our whistleblower hotline, 701-237-6576. Call that number and leave your tip.
We have some